Hey, this is Garrett with Simply Act. Thanks for joining us. In this video, we're going to look at the next step in configuring your new practice that you created. So we're going to go back into our admin settings screens, and the next tab that we're going to look at is our notifications tab. And so in the last step, we looked at configuration. So we set started templating out our schedule. We added some appointment types and reasons and anesthesia types. And I've added a few more since we were in that video. So consultation, surgery, post-op, consult, and surgery. And the reason that's pertinent is it'll help me illustrate this notifications section. So if we get back into our notifications section, we have a top section where we're going to set our registration settings and then actually the notifications below. So I'm going to click Edit in my registration section. So what this allows me to do is set the time interval for my demographics and insurance and health history. The default set to 9 months for demographics and insurance and 4 weeks for health history, but these can be changed to whatever you want for your specific practice. This is essentially going to give the system the metrics by which to measure whether or not a patient's registration data set is within the date that you want it to be, whether it's good data or whether it's expired data. So in this case, if the patient or your office or another office hasn't confirmed that the demographics and insurance sections are complete and up to date within 9 months, the system's going to essentially flag that that patient needs to register for any pertinent upcoming appointments, which we'll get to next. And in this case, if the health history data is older than 4 weeks, it's also going to know to flag that the patient needs to complete those registrations prior to the appointment. And then this section to the right is where we're going to tell the system what of our appointment types that we've configured should it actually ask the patient to register for. So, for like a post-op appointment, we're generally not going to, it's not really going to be pertinent the patient registers for that appointment, but for a consultation, for sure, we're going to want the patient to register for that. For a consult and surgery. And then when it comes to surgery, that one's kind of in the gray area, which traditionally we probably haven't thought of as the patient registering for that appointment. But there are times where, we did the consult 6 months ago and now the patient's finally scheduled for surgery. So our thinking is that that type of appointment will still put in here as something that the patient should register for, so that if either of these are out of date, so let's say it's been 6 months, a lot could have changed with their health history in 6 months. So minimally, the system's going to ping them to go back in and review and either confirm that everything is the same and that nothing's changed, or make any small updates that they need to, so that we know that we have an up-to-date health history data set. So I'm going to save that section. And so now anytime a patient's scheduled for a consultation, the system will know that they need to register for that appointment, and the system will then be able to see, okay, the data that we have is from 2 weeks ago because the patient's already registered or another office has already confirmed the data. So the patient may not need to get pinged with a registration notification. But if it is out of date or it's never been done, the system will know to send those notifications to nudge that patient to register prior to them coming in and provide them with the resources to do so. So once we've completed that top section, we move down to the notifications. There's some default notifications on the platform: an appointment confirmation message and appointment reminder. But both of those are set to off to start with. But if we click into one of those, we'll kind of see the layout of these notifications. So for these default notifications, it's already been populated with some default language that you can keep or technically change if you want to add your own in there. Or you could keep this appointment confirmation off and you could just configure your, a whole other new appointment confirmation message if you wanted to. But if you want to use the default confirmation message that we've already populated into the system, you can. You can turn that to on. It's currently set to go out by email and text, but you could definitely toggle either of those off. So I'll keep both of them on for now. And you notice when I toggle that off, the notification content section changes because the email section is no longer pertinent. So all we see is text and SMS. But if I turn email back on, I can now toggle between those two and look at the specific content for each. So we'll keep those on. Next section is timing. So we have the ability to control when this message goes out to patients. So the default that we're set to is 3 business days prior to that appointment that they need to confirm, which we'll set in just a second. But that can be changed if your office does things differently. So in this case, let's say you manually confirm your appointments 2 business days prior to appointments. Could set it to 3 business days, and what that would then allow is some of those patients that you might normally manually confirm, they may have already confirmed, and it can save you work on not needing to duplicate that in a manual fashion. But again, this can be set to whatever makes most sense for your practice. And then this second section allows us to set essentially how long, many days or weeks or months before an appointment, can a patient confirm their appointment. And so the idea here is that, let's say that we set this to a month, which doesn't make a ton of sense to me, but again, maybe that fits your workflow in some way, but the patient would be allowed to confirm their appointment up to a month before the appointment. The problem I see there is, that far out from an appointment, is a confirmation really something we can trust, or does it need to be closer, i.e., maybe you want to set yours to 3 days. They can't confirm any closer than 3 days to an appointment. And then again, the system will dynamically use that information to control that confirmation side of things. The next step is to choose what type of appointments need to be confirmed. So again, for an appointment like post-op, maybe you don't really need the patients to receive a appointment confirmation message for something like that. But for probably all these others, I would personally want to confirm those appointments. So again, this goes back to allowing you to configure this in a very just customized way to what makes sense for your appointment types and your practice. And then we have the ability to further modify who's getting this message by appointment reason. So let's say, again, for a general appointment confirmation message, probably not super pertinent, but let's say we have a specific text that we want to go out to only patients who are getting their wisdom teeth out, to only patients who are getting their wisdom teeth out and getting IV sedation, who are only getting wisdom teeth out under IV sedation at our main office, and who are also only getting their procedure done with this particular provider. And so you don't have to further, again, modify it by those, but you can. So one of the ways this can be used is if you want to set up a very personalized message flow for certain situations. So only for patients who are getting wisdom teeth out. So they're going to get, let's say, a preoperative instruction video texted to them the day before surgery. They're going to get, after surgery, they're going to get a post-operative third molar or wisdom tooth video that's specific to third molars and wisdom teeth. All of that can be accomplished. And let's say you want to further, you've got one of those pre-op, one of those post-op videos that is specific to each provider, because each provider records their own custom video. Then again, you could say, okay, I want this particular notification that has a link to the video from Dr. Jones to go out only to folks who've had wisdom teeth out. We could modify this to say it's only for surgery appointments. So only goes out for folks who had a surgery appointment when that surgery was of a wisdom tooth type and the provider on that appointment was Bill Jones. So then you could set this up for each provider in your office so that instead of the patients receiving just a real generalized notification that's a practice level video or something, they have the ability to receive very personalized interaction, which patients love. So anyways, on the appointment confirmation, I'm not going to change any of the content from what our default is currently. We've turned it on. We've kept our timing the same as the default, but we could change that. I've added the appointment types that I want this notification to go out for. So I click save, and now that appointment confirmation is turned on. Appointment reminder, same idea. There's some default content. In this case, it's just going out via text and SMS unless you add your own email content, but we'll turn it on. In this case, it's set to go out 2 hours prior to appointments. And reminders, again, similar. We can just select which types of appointments we want that going out for. Similarly, I'll leave post-op off in this case. I won't further modify things because this is a general message. And then I can hit save. And then right here, I can add my own custom notification, call it whatever I want, turn it on and off, select the channel or route that I want it to go out for. In this case, there's no default content, so we need to add our own content. So title, body. System allows you to add in appointment details. So the system would automatically populate some appointment details, such as time and provider and things like that. You can add in or leave off your practice contact information. Again, I can select timing. So in this case, it kind of defaults to 1 day before, but let's say I want this one to go out, say 2 hours after the appointment. I want it to go out for consultations, but only consultations that are for wisdom teeth and with this particular provider. And then I'll just add in some quick test content so that it'll allow me to save. So there are some required fields. As you notice, I got down here, the save button wasn't active because we didn't have anything added to our body field. So I can save that. It adds my custom notification. It again could be a review request after the appointment, could be some sort of link to a post-operative video or pre-operative video, things of that nature. And then I do have the ability to add on email content. So let's say I wanted to add a specific piece of content to one of my email notifications. So let's say in this case it's for only patients who are getting IV sedation. And I want to add this onto my confirmation notification. I can add in specific information that's only going to go out again, or it's going to get added on to an email that goes out with your confirmation message, but it's going to be dynamic to only patients getting IV sedation. So it allows you to just modify those other notifications. These notifications, you can add add-on content to any of those that are going out via email, so that patients are getting, again, very customized notifications that we're only presenting them hopefully with information that's pertinent to them, so that we're decreasing the amount of noise that we're giving them, increasing the amount of signal that we're giving them, and hopefully providing not only a better experience to them, but also hopefully getting the important information through to them so that our appointments can be as successful as possible. So anyways, this is quick run through on the registration settings and the notification settings. As always, something that once you've had a chance to digest this and work through some of this on your own, we can further fine tune and dig into some of the deeper layers on a follow-up call where we get everything finalized for you. So hopefully this is helpful. As always, let us know if you need anything, and we'll talk to you soon. Thanks.